A stroke can strike without warning, stealing a person's independence in an instant. One moment, everything seems normal, and the next speech becomes slurred, vision blurs, or an arm suddenly weakens. These are not just fleeting discomforts. They may be signs of a silent attack on the brain. Stroke doesn't just disrupt life, it can end it in seconds. In the United States, stroke is the fifth leading cause of death, and one of the top causes of long-term disability. Nearly 800,000 Americans experience a stroke each year, and about 75% of these cases occur in people aged 65 and older. For seniors, a stroke is not just a medical emergency, it is a turning point in life, where independence may be replaced by complete dependence on caregivers. The impact of a stroke extends beyond the individual. Survivors often face lifelong challenges, from losing the ability to move independently to struggling with speech or memory loss. Families become caregivers overnight, sacrificing their own time, careers, and personal lives to support their loved ones. But here's a truth that few people know: up to 80% of strokes are preventable. Yes, with the right knowledge and quick action, the risk of death and disability can be significantly reduced. The key is early recognition of warning signs. A bit of dizziness, a slight numbness, a sudden headache, these are not just minor annoyances. They may be your body's desperate cry for help. In this video, you will learn about the 7 critical symptoms that may indicate a stroke is approaching. Some of these are clear, while others are easily overlooked. You will also discover the main causes of stroke, why seniors are particularly vulnerable, and most importantly, how to prevent it. Whether you are over 60 or caring for an elderly loved one, understanding this information can be life-saving. Now, let's begin by understanding what a stroke is and why it is especially dangerous, particularly for older adults. A stroke is a sudden interruption of blood flow to a part of the brain, and this disruption can have devastating consequences. The brain, like any other organ, requires a constant supply of oxygen and nutrients carried by the blood. When this supply is cut off, even for a few minutes, brain cells begin to die. This is why stroke is considered a medical emergency, because every second without blood flow means more brain cells lost. There are 2 main types of strokes, each with distinct causes and consequences. The most common is an ischemic stroke, accounting for approximately 87% of all cases. This type occurs when a blood vessel supplying the brain becomes blocked. The blockage is usually caused by a blood clot or a buildup of fatty deposits, plaques within the arteries. When this blockage prevents blood from reaching the brain, the affected area is deprived of oxygen and the brain tissue begins to die. The second type is a hemorrhagic stroke, which is far less common but often more severe. This occurs when a blood vessel in the brain bursts, causing bleeding directly into or around the brain tissue. The cause may be high blood pressure, which weakens the walls of blood vessels over time, or an aneurysm, a weak spot in a blood vessel that can rupture. When bleeding occurs, it not only deprives part of the brain of oxygenated blood but also puts pressure on surrounding brain tissues, causing even more damage. But why is stroke so dangerous, especially for seniors? The answer lies in the nature of brain cells. Neurons, the cells that make up the brain, are highly sensitive to oxygen deprivation. Within minutes of a stroke, brain cells in the affected area begin to die at an alarming rate, nearly 2 million cells per minute. This rapid loss can result in permanent damage, affecting a person's ability to speak, move, remember, or even recognize loved ones. For seniors, the danger is even greater. As the body ages, blood vessels become less flexible and more prone to damage. Conditions like high blood pressure, diabetes, and heart disease become more common, all of which increase the risk of stroke. Moreover, the brain of an older adult is often less resilient, making recovery slower and less complete. Even a mild stroke can leave a senior struggling with basic tasks, from getting dressed to feeding themselves. But there is another critical factor: time. Stroke is often described with a simple phrase, "time is brain." This means that every second counts. The faster a person experiencing a stroke receives medical treatment, the better their chances of survival and recovery. Delaying treatment, even by a few minutes, can mean the difference between a full recovery and a lifetime of disability. Modern medicine has made great strides in treating stroke. For ischemic strokes, clot-busting drugs can sometimes restore blood flow if administered quickly. For hemorrhagic strokes, surgery may be needed to stop bleeding or relieve pressure on the brain. But even the best treatments can only do so much if help is delayed. That is why recognizing the signs of a stroke and acting immediately is the most critical factor in saving a life. In this video, you will learn how to identify those warning signs early, how to act without hesitation, and how to protect yourself or your loved ones from the devastating effects of a stroke. One of the clearest signs that a stroke may be approaching is a sudden severe headache. But this is not just any headache. It is a thunderclap, a bolt of pain that strikes without warning. It can be so intense that it is often described as the worst headache of a person's life. This headache may be accompanied by nausea, vomiting, or even loss of consciousness. Medically, this type of headache is a red flag for a hemorrhagic stroke, where a blood vessel in the brain ruptures, causing bleeding. The pressure from the bleeding damages brain tissue and can lead to sudden life-threatening consequences. Ignoring this kind of headache could be a deadly mistake. Another warning sign is sudden dizziness or loss of balance. This is more than just feeling lightheaded. It is a sensation of the room spinning, a complete loss of control. For seniors, this is particularly dangerous because it increases the risk of falling, which can lead to fractures or head injuries. Dizziness occurs when the part of the brain responsible for maintaining balance is affected by a lack of blood flow. The world seems to tilt, and the person may feel as if they are being pulled to one side. This is not a simple problem with the inner ear. It is a potential sign of a stroke affecting the cerebellum or brainstem. Numbness or weakness in the face, arm, or leg is another critical warning sign. This often appears on just one side of the body, a characteristic known as hemiparesis. A person may notice that one side of their face droops, they may be unable to raise one arm, or they may experience a strange tingling numbness in their fingers. This occurs because the part of the brain that controls muscle movement has lost its connection to the affected side of the body. Even if the numbness is temporary, it should never be ignored. Confusion, difficulty speaking, or understanding speech is another red flag. A person may suddenly struggle to find the right words, slur their speech, or seem unable to understand what others are saying. This is known as aphasia, and it occurs when a stroke impacts the regions of the brain responsible for language processing, such as Broca's area or Wernicke's area. In some cases, the person may appear disoriented or make sentences that do not make sense. Even if this confusion disappears, it should not be dismissed. Vision problems are a common warning sign of stroke that is often overlooked. A person may experience blurred vision, double vision, or even a sudden loss of vision in one or both eyes. This happens because a stroke can affect the occipital lobe, the part of the brain responsible for processing visual information. The person may think they just need new glasses, but in reality, their brain is struggling to interpret what their eyes see. A shadow over the field of vision, partial blindness, or seeing flashes of light are all symptoms that should raise immediate concern. Difficulty walking or a sudden loss of mobility can also signal a stroke. A person may suddenly feel weak in their legs, have trouble coordinating their movements, or feel as if their body is not responding properly. This is because the part of the brain that controls muscle coordination and movement is being deprived of blood. For seniors, this symptom is extremely dangerous because it increases the risk of falls, which can cause additional injuries. Another serious symptom is slurred speech or difficulty communicating. The person may speak in a way that is hard to understand, their words may be jumbled, or they may seem unable to form complete sentences.
This can happen because a stroke has affected the areas of the brain that control the muscles used for speech, as well as those that help process and understand language. Even if this symptom appears and then disappears, it should not be ignored, because it is a clear sign that the brain is in danger. But what makes these symptoms so dangerous is that they can appear suddenly and disappear just as quickly. This phenomenon is known as a transient ischemic attack TIA, or a mini-stroke. A TIA occurs when blood flow to the brain is temporarily blocked and then restored. While the symptoms may go away on their own, they are a serious warning. A TIA is not a harmless event, it is a red flag that a full-blown stroke may be on the way. According to medical research, 1 in 3 people who experience a TIA will have a major stroke within a year. Understanding these symptoms is not just about knowing what to look for, it is about recognizing that time is of the essence. Stroke is often described with a simple phrase: time is brain. Every minute that passes without treatment means more brain cells are dying, nearly 2 million cells per minute. This is why immediate action is critical. If you or someone around you experiences any of these symptoms, even if they seem to come and go, it is essential to act fast. Call emergency services immediately. Do not wait to see if the symptoms will get better. Do not try to sleep it off, or wait for them to pass. Stroke is a medical emergency, and every second counts. But why do these symptoms appear so suddenly? The answer is in the nature of the brain itself. The brain is a complex network of millions of nerve cells, each responsible for controlling specific functions. When blood flow to a part of the brain is interrupted, the affected cells begin to die within minutes. Depending on which area of the brain is damaged, different symptoms will appear. If the stroke affects the part of the brain that controls speech, a person may struggle to speak or understand words. If it affects the area responsible for movement, they may become weak or paralyzed. If the visual cortex is impacted, vision may become blurred or disappear entirely. Recognizing these 7 symptoms can save a life. They are the body's way of signaling that something is terribly wrong. But awareness is just the first step. Knowing how to respond quickly is what truly makes the difference.
The causes of stroke in seniors are numerous and often interconnected, making older adults particularly vulnerable. Among these, high blood pressure, also known as hypertension, is the most significant and common cause. When blood pressure is consistently high, it puts immense pressure on the walls of arteries, causing them to become thicker, stiffer, and more prone to damage. Over time, this pressure can weaken the arteries in the brain, making them more likely to rupture, leading to a hemorrhagic stroke. Alternatively, high blood pressure can cause the arteries to narrow, increasing the risk of a clot blocking blood flow and causing an ischemic stroke. Another major contributor is diabetes. High blood sugar levels damage the small blood vessels throughout the body, including those in the brain. Over time, this damage can cause the blood vessels to become fragile, thickened, or completely blocked. In seniors, diabetes is particularly dangerous because it often coexists with other risk factors like high blood pressure and high cholesterol, creating a perfect storm for stroke. Even those who manage their blood sugar well are still at an increased risk because of the long-term effects that diabetes has on blood vessels. High cholesterol is another critical factor. Cholesterol is a fatty substance that can build up on the walls of arteries, forming what is known as plaque. This plaque can narrow the arteries, reducing blood flow and increasing the risk of a blockage. In some cases, a piece of this plaque can break off and travel to the brain, where it can lodge in a small artery, causing an ischemic stroke. High cholesterol is particularly problematic for seniors because the body's ability to clear cholesterol from the blood decreases with age. Heart diseases are also a leading cause of stroke among seniors. Conditions like atrial fibrillation, a type of irregular heartbeat, dramatically increase the risk of stroke. In atrial fibrillation, the heart's upper chambers beat irregularly, allowing blood to pool and form clots. If one of these clots travels to the brain, it can block a blood vessel and cause a stroke. Other heart conditions, such as heart valve disorders or a history of heart attack, also elevate the risk, because they can create conditions where clots are more likely to form. Smoking is another well-known cause of stroke. The chemicals in tobacco damage the lining of blood vessels, making them more susceptible to plaque buildup and narrowing. Smoking also makes the blood thicker and more likely to clot, which can directly lead to a blockage in the brain. For seniors who have smoked for decades, the cumulative damage to their cardiovascular system can be severe, significantly increasing their stroke risk. Obesity and a sedentary lifestyle further add to this danger. Excess weight puts additional strain on the heart and blood vessels, while a lack of physical activity can lead to poor circulation and an increased risk of high blood pressure, diabetes, and high cholesterol, all major stroke risk factors. In seniors, maintaining a healthy weight is more challenging due to a slower metabolism, reduced muscle mass, and decreased physical activity. But without regular exercise, the risk of stroke continues to rise. Family history also plays a significant role. If a person's parents or siblings have had a stroke, their risk is naturally higher. This is due in part to shared genetic factors, but it may also be influenced by shared lifestyle habits, such as a family tendency toward unhealthy eating, smoking, or lack of exercise. Even without any other risk factors, a strong family history of stroke should be considered a serious warning sign. But why are seniors particularly vulnerable to strokes? The answer is a combination of biological changes and lifestyle factors. As the body ages, blood vessels naturally become less flexible and more prone to damage. This means that even minor increases in blood pressure can have a more significant impact. Moreover, the body's ability to repair damaged blood vessels declines with age, increasing the likelihood that a small problem will become a major one. Seniors are also more likely to have multiple chronic conditions, such as high blood pressure, diabetes, high cholesterol, and heart disease, which all increase the risk of stroke. These conditions do not just add together, they amplify one another, making the overall risk much higher. A senior with both high blood pressure and diabetes is far more likely to experience a stroke than someone who has only one of these conditions. Furthermore, the symptoms of stroke may be more difficult to recognize in seniors, both for themselves and for those around them. A senior experiencing confusion, difficulty walking, or vision problems may be mistaken as just getting older. Family members may think their loved one is simply having a bad day, not realizing that they are witnessing the early signs of a stroke. This delay in recognition can be deadly. Finally, seniors may also have a slower reaction to symptoms. They may not recognize that something is wrong, or they may be hesitant to ask for help, thinking they do not want to be a burden. But delaying action during a stroke is the worst thing anyone can do. Every second without treatment means more brain cells die, and the damage becomes harder to reverse. Understanding these causes is crucial for prevention. While age is an uncontrollable factor, many of the other risks can be managed. Regular blood pressure checks, maintaining a healthy diet, exercising regularly, avoiding smoking, and managing chronic conditions like diabetes and high cholesterol can dramatically reduce the risk of stroke in seniors. Recognizing that these factors are not just part of aging but are active threats can help seniors and their families take proactive steps to protect their health. When a stroke strikes, time is everything. Every second that passes means more brain cells die, nearly 2 million per minute. This is why recognizing a stroke quickly and acting immediately is critical. And the SAMU method is one of the simplest ways to do this. SAMU stands for Smile, Arms, Music, and Urgency. 4 simple steps that anyone can remember and apply in an emergency. The first step is smile. Ask the person to smile. Carefully observe their face. Does one side droop? An uneven smile is a clear warning sign of a stroke, indicating muscle weakness on one side of the face. This occurs because the part of the brain that controls facial muscles is affected. Even if they insist they feel fine, a crooked smile is a red flag. Next is arms. Ask the person to raise both arms. Can they lift both evenly, Or does one arm drift downward? If one arm is weak or cannot be lifted, this is another critical sign of a stroke. This happens because the stroke disrupts the brain's control over muscle movement. The third step is music. A quick way to test speech. Ask the person to repeat a simple sentence like, "The sky is blue." Listen carefully. Do they slur their words? Do they struggle to say it clearly? Speech that is garbled, confused, or slurred is a sign that the language centers of the brain are affected. Even if they seem to speak normally, after a few seconds, this symptom should never be ignored. Finally, urgency is the most important step. If any of these signs are present, a crooked smile, a weak arm, or slurred speech, call emergency services immediately. Do not wait to see if the symptoms will improve. Do not try to drive the person to the hospital yourself. Paramedics are trained to begin life-saving treatment on the way, which can save valuable time. Imagine the story of Mr. Brown, a 75-year-old man who was having breakfast with his daughter when she noticed something was wrong. He smiled, but one side of his face didn't move. When she asked him to lift his arms, one arm stayed weak, his words were slurred, and he seemed confused. Remembering the SAMU method, his daughter called emergency services immediately. Thanks to her quick action, paramedics arrived in minutes, and Mr. Brown received treatment. On the way to the hospital, he made a full recovery because help arrived in time. The SAMU method is so effective because it is simple and easy to remember. In an emergency, panic can make it hard to think clearly, but with SAMU, just 4 simple steps can save a life. It is a tool anyone can use, family members, caregivers, even neighbors, and the faster you act, the better the outcome. When it comes to stroke, immediate treatment can make the difference between life and death, or between a full recovery and a lifetime of disability. For an ischemic stroke, which occurs when a blood clot blocks a blood vessel in the brain, the most effective emergency treatment is a clot-busting medication known as tissue plasminogen activator, TPA. This drug works by dissolving the clot and restoring blood flow to the affected part of the brain. However, TPA is time-sensitive. It must be administered within 4.5 hours of the first symptoms appearing. The faster it is given, the better the outcome. In some cases, when TPA cannot be used or is not effective, a procedure known as thrombectomy may be performed. During a thrombectomy, doctors insert a thin, flexible tube called a catheter into a blood vessel, navigate it to the site of the clot, and physically remove the blockage. This procedure is most effective within the first 6 hours of a stroke, but can sometimes be successful even up to 24 hours after symptoms begin, depending on the location of the clot and the condition of the patient. For a hemorrhagic stroke, where a blood vessel in the brain has burst, the treatment is different. The primary focus is to stop the bleeding and reduce pressure on the brain. Medications may be given to lower blood pressure, control bleeding, and prevent seizures. In severe cases, surgery may be required to repair the damaged blood vessel, remove a blood clot, or relieve pressure on the brain caused by excess fluid. This may involve a craniotomy, where a section of the skull is temporarily removed to access the brain. But stroke treatment does not end in the emergency room. Recovery is a long process, often requiring rehabilitation. This can include physical therapy to help a person regain strength and movement, occupational therapy to relearn daily tasks, and speech therapy for those who have lost the ability to speak or understand language. The goal of rehabilitation is to help the stroke survivor become as independent as possible and regain their quality of life. However, the best way to fight stroke is not just to treat it, but to prevent it. Stroke prevention begins with a healthy lifestyle. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can significantly reduce the risk. Limiting salt, sugar, and unhealthy fats can help maintain healthy blood pressure and cholesterol levels. For seniors, who may have different nutritional needs, it is important to focus on nutrient-dense foods that provide vitamins and minerals without excess calories. Regular physical activity is another key to prevention. This does not mean intense workouts. Something as simple as a daily walk, yoga, or light stretching can improve circulation, strengthen the heart, and maintain a healthy weight. For those who may have mobility issues, chair exercises or water aerobics are excellent low-impact options. Exercise also helps regulate blood sugar levels, which is crucial for those with diabetes. Controlling blood pressure is one of the most important steps in stroke prevention. High blood pressure is the leading cause of stroke, and it can be managed through medication, diet, and regular physical activity. Regular blood pressure checks are essential, especially for seniors who may not always experience obvious symptoms of hypertension. Another critical factor is managing blood sugar levels, particularly for those with diabetes. Regular monitoring, taking prescribed medication, and maintaining a balanced diet can prevent blood vessel damage caused by high blood sugar. Quitting smoking is one of the most effective ways to reduce stroke risk. Smoking damages blood vessels, increases blood clotting, and raises blood pressure. Even those who have smoked for decades can benefit from quitting as the body begins to repair itself within weeks of stopping. Limiting alcohol intake is also important. Excessive drinking can raise blood pressure and increase the risk of stroke. Finally, regular medical checkups are essential for stroke prevention. These allow healthcare providers to monitor risk factors like blood pressure, cholesterol, and blood sugar, and to provide early treatment for any problems. Seniors should ensure they have an annual physical and discuss any concerns with their healthcare provider. In the fight against stroke, knowledge is power. Understanding the treatments available and taking proactive steps to prevent a stroke can save a life. A healthy lifestyle, regular exercise, and staying aware of personal health risks are the most effective ways to protect yourself or your loved ones from this life-threatening condition. Stroke is a life-changing event, but it is also largely preventable. Understanding the warning signs, recognizing the risk factors, and knowing how to act quickly can make the difference between life and death, or between a full recovery and lifelong disability. Remember the 7 critical symptoms: sudden severe headache, dizziness, numbness or weakness, confusion, vision problems, difficulty walking, and slurred speech. These are not just minor annoyances, they are your body's urgent calls for help. Use the SAMU method, smile, arms, music, urgency, to quickly identify a stroke and respond without delay. If you notice any signs, act immediately. Call emergency services. Time is brain, and every second counts. But do not wait for a stroke to strike. Protect yourself and your loved ones by adopting a healthy lifestyle. Maintain a balanced diet, exercise regularly, control blood pressure and blood sugar, avoid smoking, and limit alcohol. Regular checkups are your best defense. If you found this video helpful, please give it a thumbs up, share it with your friends and family, and subscribe to our channel. Don't forget to tap the notification bell so you never miss our latest health tips. Remember, knowledge is power, and what you learn today can save a life tomorrow. Stay healthy, stay safe.